Wala pa pala yung auditory diagnosis po. Ang ating topic ay chronic cough. So cough following acute upper respiratory infection are due either to phlegm heat or dryness with phlegm. So chronic cough, full, damp phlegm in the lungs. Chronic cough with easy expectoration of profuse white sputum, rattling sound in the throat, white, pasty complexion, a feeling of oppression in the chest, shortness of breath, dislike of lying down. Ito yung talagang ayaw nilang humiga. Wheezing, nausea, swollen tongue with a sticky white coating, and ang pulse po nila is delivery. Ito yung mga nahihirapang mahiga, bunang ubo. So, acupuncture po natin ng lang 5, lang 7, lang 1, lang 12, lang 9, and stomach 40. Phlegm dryness in the lungs, chronic dry cough with a weak sound, and occasionally difficult expectoration of scanty sputum, shortness of breath, a feeling of oppression in the chest, dry throat, wheezing, pasty dry complexion, swollen tongue with a dry sticky coating, fine slippery falls. So, pareho din po yung acupuncture, lang 5, lang 7, lang 1, lang 12, lang 9, stomach 40, stomach 36, spleen 6, and kidney 3. Pag empty naman po, ito ay ang lung deficiency. So, chronic cough that is dry or with difficult expectoration of scanty sputum. Ito yung sinasabi natin kanina na ang hirap nilang ilabas yung phlegma. Weak and or hoarse voice, dry mouth and throat, sticky throat, madali po silang mapagod, ayaw nila magsalita, thin body or thin chest, nagkakaroon ng pamamawi sa gabi, normal colored ang tongue without coating. So, pwedeng pinkish pero wala siyang coating. Or with rootless coating. Sa in front part, kasi andun diba sa yung lungs, floating empty pulse. Acupuncture po natin ang lang 9, lang 7, lang 12, stomach 36, and spleen 6. Lang deficiency with empty heat. So mayroon po siyang chronic cough that is dry or with difficult expectoration of scanty sputum. That may be blood tinged, dry mouth and throat at night, thickly throat, tiredness, dislike of speaking, thin body or thin chest, night sweating, malar flash, a feeling of heat or low-grade fever in the evening, 5-pound heat, thin body, red tongue without coating, floating empty and rapid pulse. Acupuncture po natin ang lang 9, lang 7, lang 12, stomach 36, spleen 6, and spleen 10. Nagkaroon po kami ng ganitong pasyente na talagang may konting blood, pero nung pumunta naman po sa doktor, tapos na-check yung kanyang kanyang baga, negative naman po at saka yung kanyang sputum. Pero nagtataka at lagi nang may konting blood. So nang na-acupuncture po, nawala siya. Empty heat pala siya. Lung dryness. Chronic dry cough. So alam natin pag dry dry cough, dry skin, dry throat, puro dry ang makikita natin, dry mouth, tapos thirst, hoarse voice, dry tongue, floating empty pulse. Pag lang deficiency naman, siya po ay may chronic slight cough with a weak sound, slight shortness of breath, weak po yung kanyang voice, spontaneous daytime sweating. Kahit malamig, pinapawisan po itong mga taong ito. Ayaw niya magsalita. Then, bright white complexion. Propensity of catching cold. Kunting hangin lang, yun, nilalamig na. Dalhin po siyang mapagod. Dislike of cold. Kung tinignan po ninyo ang tongue, pain. Then, ang pulse ay empty. Pag cold phlegm naman po sa lungs, ito din ay chronic cough with expectoration of, siyempre pag cold ay white, watery sputum. Pag meron pong cold, na-aggravate po ito. Exposure to cold. Feeling cold of hands, phlegm in the throat, dizziness, a feeling of oppression of the chest, feeling of cold of the chest. Then pag tinignan niyo ang tongue, swollen po to with and wet with sticky white coating. Then ang pulse ay sleep and slow. Pag yung liver naman po ay liver fire insulting the lungs, so nagkakaroon po ng chronic barking, cough with yellow or blood tinge sputum. Breathlessness, asthma, a feeling of fullness and tension of the chest, and hypochondrium. Sakit po yung ulo niya, nahihilo siya. Pag tininin yung face, red. Buhawin din po ito at may mapait na panlasa. Bloodshot eyes, may parang dugo-dugo yung yung mata niya. Scanty dark urine. Nagkakaroon din po siya ng constipation. Then, ang tongue ay red with breather side and dry yellow coating. Ang pulse po niya ay wiry. Phlegm fluids in the lungs. So, chronic cough with expectoration of white, watery, fruity sputum. Breathlessness, splashing sound in the chest, vomiting of white, watery, fruity sputum, feeling cold, cough that may be elicited by scale, frail tongue with thick, sticky white coating. So yung kanyang pong pulse ay fine, slippery, or weak floating. Pag pinatong natin ang kamay, naramdaman natin agad. Coughing blood. Ito naman po karaniwan, ang pag-coughing blood po may langhit. Yan, nilalabas ng katawan natin yung heat through blood. Cough with blood thin sputum. Slight breathlessness, feeling of heat, chest ache, flaring of nostril, thirst, red face, red tongue with yellow coating, overflowing rapid pulse. Pero syempre pag may coughing of blood, nire-refer po natin sa doktor para katulong natin yung mga doktor na nanggagamot kasi binibigyan po sila ng gamot para sa baga. Mas mabilis pong gumaling pag na-acupuncture. Karanasan po namin yan. Yung mga nagkakaroon ng TB, yun, mas mabilis po silang gumaling. Habang combination yung binigay ng doktor na gamot, tsaka pa yung mga side effect ng gamot na babawasan din. Phlegm heat in the lungs. So, barking cough with expectoration of blood thin sputum. So, may shortness of breath po sila, nagkakaroon ng wheezing, a feeling of oppression of the chest. Tapos, mainit talaga yung pakiramdam nila, laging uhawin, may insomnia, agitation, yung kanilang pong tongue ay red and swollen with sticky yellow coating. Ang pulse ay slippery and rapid. Pag langian deficiency with empty heat, dry po ang kanilang cough with difficult expectoration of scanty blood thin sputum. Dry mouth and throat at night. Yung gustong uminom po yan. Night sweating, tiredness, malar flash, a feeling of heat, or low-grade fever in the evening. Then meron po siyang 5-pound heat, thin body, red tongue without coating. Ang kanila pong pulso ay floating empty and rapid. Pag meron naman pong invasion of wind heat, yan. Cough with blood thin sputum. Ayaw po niya ng lamig, meron siyang fever, nagkaroon siya ng sore throat, at stop or runny nose. So yellow po yung discharge. Sumasakit din po yung ulo at saka yung katawan. Nagkakaroon ng slight sweating, slight thirst. Then pag tinignan yung tonsil is swollen. Yung tongue po nila ay slightly red on the side in the chest area or front part. Ang kanila pong pulso ay floating rapid. Pag lung and spleen deficiency naman, so slight po yung cough with expectoration of scanty blood thin sputum. ang fresh blood po yung inilalabas nila. So, madali silang mapagod, loose stool, poor appetite, slight abdominal distension. So, yung mga loose stool, poor appetite, kaya involved po yung spleen, no? And abdominal distension. Then, weak voice, slight shortness of breath, spontaneous sweating, dislike of speaking, pale tongue, empty pulse. Pag lang po yung involved, yung paghinga po natin, pagpalabas, yun ang mas mahirap. Lung heat at the blood levels. So, kung nasa blood levels po yung heat, 4 levels. So, coughing of blood, fever at night, macular skin eruptions, mental confusion, night sweating, 5 palm heat, dry throat, red tongue with red points, and without coating, fine rapid pulse. So, yun po yung mga sign ng lung heat at the blood level. So, ating pong summary, the sound of the cough and sniffles. So, observation, a loud cough with the sound of loose sputum. Ito po ay wind cold damp phlegm. Loud cough with sputum that is difficult to expectorate, lung heat or phlegm heat. Pag barking cough naman po ay lung heat or phlegm heat din. Pag loud and explosive cough, excess condition po yan. Pag dry po or ticklish cough, lung deficiency. Pag mahina lang, weak cough, deficient condition. So, sniffles, wind cold or damp phlegm. So, pag narinig natin yung mga cough, alam na natin yung gagawin kung magtatanggal tayo ng wind, kung magtotonify tayo or mag-expand. So, yan sa mga pakikinig lang po dun sa ubo. Ganun kahalaga po yung pakikinig. Thank you po for your attention.